explore the unique contributions pharmacists make to MSF missions, the challenges and enablers in humanitarian work, the initiatives MSF has implemented to integrate pharmacists into its teams, and finally, some of my recommendations on how pharmacists interested in humanitarian work can potentially prepare themselves for this rewarding path. So, without further ado, let us embark on the journey together, envisioning the difference we as pharmacists can make in the lives of those who need it most. As introduced earlier, I work for MSF, and just to ensure we're on the same page, I'm going to give a very brief background of MSF before delving into my talking points. So, MSF, or Medicine Sans Frontiers, is a global movement dedicated to delivering emergency medical assistance to those in dire need. Our teams, comprising of tens of thousands of health professionals, logistic experts, and administrative staff, are united by our charter, guided by medical ethics and the principles of impartiality, independence, and neutrality. Founded in 1971 in France by a group of doctors and journalists, MSF was born out of a response to war and famine in Biafra, Nigeria. So, this is a country in West Africa, as shown on the screen. So, from a small group of 300 individuals, we have now grown into a worldwide network of over 67,000 people working in over 70 countries. Our mission is clear: to ensure that no one is denied healthcare because of conflict, epidemics, disasters, or exclusion from medical services. Our principles are rooted in the belief that every human being deserves quality healthcare regardless of their background, and since our inception, MSF has treated over 100 million patients, continually advocating for those neglected by the global health system. Our commitment was recognized when we were awarded the Nobel Peace Prize in 1999, which is a true testament to an unwavering dedication to humanitarian work. So you might be wondering, Doctors Without Borders sounds amazing, but why are pharmacists there? I mean, the name is Doctors Without Borders and not Pharmacists Without Borders, and this might be a reasonable thought. But pharmacists are not just essential, they are indispensable to MSF humanitarian missions. Here's how. Firstly, medication management and optimization. Pharmacists ensure optimal use of medical resources, meticulously managing medical stock to prevent shortages and wastage. They oversee the procurement, storage, and distribution of medications, making sure that each pill reaches its intended patient, no matter where they are in the world. Next, we have clinical expertise. Pharmacists' deep understanding of pharmacology and therapeutic is crucial, as they assist in providing direct patient care, advising on the best use of medication, and vigilantly monitoring for adverse effects. Pharmacists' expertise is essential in managing complex medication regimens, tailoring treatments to the specific needs of each patient, and ensuring they receive the best possible care. Next, we have public health initiatives. Pharmacists extend their impact beyond the clinic or hospital, ranging from playing a role in antimicrobial stewardship programs to combat resistance, all the way to vaccination campaigns that protect entire communities. Pharmacists' role is also pivotal in liaising with governing bodies and other healthcare professionals, ensuring the safe and effective use of medications on a large scale. Lastly, we have support in diverse settings. Whether in field hospitals, outreach clinics, or even coordination centers, pharmacists adapt to any environment. Pharmacists' role is versatile, from direct patient care to strategic planning and policy implementation. Pharmacists' dedication to humanitarian principles shines through in every setting, but having said this, it's not always easy. As a pharmacist in MSF, you face challenges such as resource scarcity, where in many regions, medication and supplies are scarce. Therefore, you need to innovate, managing with limited resources and finding ways to provide the best care despite the shortages. Next, we have logistical complexities. The journey of medical supplies can be full of delays and challenges. You need meticulous planning and adaptability to ensure their medications reach their destination without fail. There's a really nice FIP webinar which hits the nail on the head with regards to this topic, and I would definitely advise anyone who is interested to go check it out. Third, we have unstable contexts. Operating in conflict zones or disaster-stricken areas means you will often face volatile and unsafe conditions. Your resilience and situational awareness are crucial in navigating these challenges. Fourth, you have cultural and language barriers. Understanding and respecting the cultural context of the communities you serve is essential for providing compassionate and effective care. This is where effective communication is key. So, even though we face all these challenges, on the other hand, we also have strengths that we embrace as pharmacists. Strengths such as strong professional training. Pharmacists' rigorous education equips us with the skills needed to tackle a wide range of challenges. The training is also the foundation enabling pharmacists to manage medical and logistical hurdles with confidence. Next, we have interdisciplinary collaboration. By working closely with doctors, nurses, and logisticians, not only are problem solving capabilities enhanced within the team, but also we see improved patient care. This teamwork is the heart of MSF approach, fostering a synergy that drives success. Next, we have competency frameworks. The FIP competency framework provides a solid foundation, standardizing practices and offering clear guidance to support pharmacists in humanitarian settings. The full document is available on the FIP Humanitarian page, and I will definitely advise pharmacists interested in humanitarian work to use this resource. So, in addition to the strengths that we as pharmacists embrace, we also have strategic initiatives from MSF which also empower us as pharmacists. We have structured roles and responsibilities, where clear roles within the pharmacy team, from field pharmacists to mission pharmacists and even regional coordinators, streamlines operations and enhances medication management efficiency. We have training and competency development. As MSF prioritizes continuous professional development, it offers tailored training in clinical skills, supply chain management, and leadership. This ensures pharmacists are well prepared to face the unique challenges of humanitarian work. Next, we have collaborative frameworks. MSF promotes a collaborative environment where pharmacists work alongside other healthcare professionals. This interdisciplinary approach ensures comprehensive patient care and optimal resource utilization. Next, we have advanced logistical systems. By implementing sophisticated logistics and supply chain system, MSF enables pharmacists to manage medical supplies effectively, ensuring stock levels are optimal and responsive to changing needs. And lastly, policy and advocacy. MSF advocates for the recognition of pharmacists' roles in humanitarian settings, ensuring your expertise is fully utilized. This advocacy helps integrate pharmacists more deeply into the healthcare delivery process. So, for those of you who are inspired to join this noble cause, here are some of my key recommendations to prepare for a career as a humanitarian pharmacist. First and foremost, gain relevant experience. Experience in diverse healthcare settings is invaluable. Volunteer in local or international health projects to gain practical insights into the challenges and rewards of humanitarian work. Next, pursue specialized training. Seek out training in humanitarian health, public health, and also disaster response. Familiarize yourself with the frameworks like the FIP competency framework that we've just gone through that previous slide to understand the required skills and competency. Third, develop flexibility and resilience. Humanitarian work is extremely unpredictable. Cultivate flexibility, problem solving skills, and resilience to adapt effectively to changing conditions. Fourth, enhance interdisciplinary skills. Strong communication and teamwork skills are essential. Building relationship with a diverse range of professionals is crucial for successful missions. And lastly, stay informed and network. Keep updated on global health developments and humanitarian aid. Join professional organizations, attend conferences, and network with peers to stay informed and connected. For example, the FIP Congress happening in Cape Town in September can be a great place to start, or attending webinars such as this one. By following this recommendation, you'll be well prepared to embark on this fulfilling journey, contributing your expertise to make a tangible difference in crisis affected communities. In closing, your journey as a humanitarian pharmacist is not just a career, it is a profound commitment to humanity. It is a chance to utilize your skills, to push the boundaries of what is possible in healthcare, and to bring hope to those who need it most. Pharmacists make a difference, turning challenges into opportunities and saving lives one medication at a time.